On an air trip back home, a woman begins to complain of a horrible headache and asks for help. However, when her flight attendant investigates deeper, what she discovers makes her immediately call the pilot. As Flight 312 cruised smoothly at 30,000 feet, most passengers were nestled into their seats, headphones on, eyes closed, drifting into movies or music. But not Janet Whitlock. She sat rigid, her hands clutched tightly at her temples, a grimace etched across her face. Every few seconds, she would squeeze her eyes shut, her body tensing as waves of excruciating pain washed over her. The stark contrast between her silent agony and the quiet hum of the aircraft created a palpable tension in the air around her. What was causing her so much pain? Janet was returning from a 3-week volunteer mission in Central America, where she had been helping to set up mobile clinics in remote villages. As a nurse practitioner, Janet had dedicated her career to providing essential medical services in underserved areas. This trip had been particularly challenging due to the rugged terrain and the lack of basic amenities, but also incredibly rewarding. Janet had worked closely with local health workers, sharing her knowledge and learning about traditional healing methods unique to the region. The mission had extended unexpectedly when a sudden outbreak of dengue fever broke out in the region. Janet had stayed on to help manage the crisis, working tirelessly to treat patients and train volunteers. By the time she boarded her flight home, she was exhausted but fulfilled and eager to return to her family. Janet's longing to return home had grown with each passing day of her mission. She had been away from her husband and 2 young children for nearly a month, and she missed them deeply. Every night, after long days of treating patients and coordinating with local health teams, she would video call them, sharing stories of her day and listening to the small, everyday details of their lives back home. These conversations were the highlight of her evenings, filling her with warmth and reminding her of why she worked so hard. As the plane took off, Janet thought about the surprise she had planned for her kids. She had picked up small, handcrafted toys from a local market, colorful wooden puzzles for her 5-year-old son and a set of handmade dolls for her 8-year-old daughter. She imagined their faces lighting up with excitement, the joy of the reunion playing over and over in her mind. She also looked forward to a quiet evening with her husband, sharing a meal and recounting the more challenging aspects of her trip, finding comfort in his support. As the plane soared above the clouds, Janet shifted uncomfortably in her seat. The initial excitement of her trip home was overshadowed by a throbbing headache that grew worse with every passing minute. The pain that Janet experienced was not just any ordinary headache. It was as if a vice was tightening around her skull, pulsating with a rhythm that matched the beating of her heart. Each throb sent sharp, stabbing sensations behind her eyes, making it nearly impossible to focus on anything else. It felt like needles were being driven into her temples, and occasionally a wave of nausea would wash over her due to the intensity of the pain. The brightness of the in-flight entertainment screen only seemed to worsen her discomfort, as it casted glaring light that pierced her eyes, compelling her to shield her face with her hands. Still, she tried to distract herself with the in-flight movie, but the pain was relentless. Finally, she couldn't take it any longer and pressed the call button for the flight attendant. Laura, the flight attendant, promptly approached her with a friendly yet concerned expression. "Hello, I noticed you called for assistance. How can I help you today?" Laura asked, positioning herself to be at eye level with Janet, ensuring her voice was soothing and calm. Janet attempted a weary smile, clutching her head slightly. "I'm sorry to trouble you, but I have a horrible headache. It's quite severe and nothing seems to help." Laura nodded understandingly, her training kicking in as she assessed Janet's discomfort. "I'm sorry to hear that. Let me get you some water and perhaps an ice pack for your head. Have you had anything to eat or drink recently that might have triggered this?" "No, nothing unusual," Janet replied, shaking her head slowly, which seemed to exacerbate her pain. "I've just been trying to rest, but the pain is overwhelming." "Okay, I'll be right back with some water and an ice pack. Also, if you're comfortable with it, I can check if there are any pain relievers available," Laura offered, her tone both professional and compassionate. "That would be great, thank you," Janet said, managing another weak smile. As Laura turned to fetch the supplies, she couldn't help but notice the pallor of Janet's skin and the slight tremor in her hands. Something didn't seem right. Janet's skin was unusually pale, and there were faint, dark circles forming under her eyes. There was an odd rash on her head, where her hair was a little thinner, but she couldn't see much without getting uncomfortably close. However, her breathing seemed slightly labored, too. "Are you feeling any other symptoms? You don't look so good," Laura asked, her concern growing. Janet hesitated. "Actually, now that you mention it, I feel a bit dizzy and my vision is starting to blur." Laura's concern deepened as she listened to Janet describe her additional symptoms. She knew these could be signs of something more serious than a simple headache. "I see," Laura said, maintaining a calm demeanor despite her growing worry. Dizziness and blurred vision can be concerning, especially with your headache. Have you experienced anything like this before? No, this is all new to me, Janet replied. Her voice tinged with anxiety. It's really quite scary. Laura placed a comforting hand on Janet's shoulder. We're going to take good care of you. We are trained to deal with and handle medical situations such as this. I'll make sure we have everything ready for when we land, and I'll notify the captain about your condition immediately. Thank you, I appreciate it, Janet said, her breath shallow. I've been traveling quite a bit recently. I just came back from a volunteer mission in Central America. We were setting up mobile clinics in remote villages. At the mention of Central America, Laura's focus sharpened. Thank you for sharing that, Janet. It's important information. I need to speak with the captain immediately to discuss our options, she said with calm professionalism. Please rest here and I'll ensure we take the appropriate steps quickly. Janet nodded. Thank you, Laura. Laura offered a reassuring nod and quickly made her way to the cockpit. Her steps were measured and swift, reflecting the urgency of the situation without causing panic among the other passengers. She knew that clear communication with the captain was crucial in ensuring Janet's safety and well-being. Laura had good reason to be concerned. Given Janet's recent travel to Central America and her current symptoms, there was a possibility of exposure to infectious diseases uncommon in their home country. The combination of severe headache, dizziness, and blurred vision could indicate something much more serious than they were equipped to handle. Upon entering the cockpit, Laura quickly relayed the critical details to the captain. One of our passengers is experiencing severe symptoms that started during the flight. She recently returned from a volunteer mission in Central America, she explained. The captain listened intently, his expression growing serious. Understood. I'll contact air traffic control immediately and arrange for medical assistance on our arrival. We need to expedite our descent to ensure she receives the necessary medical attention as soon as possible. Thank you, Captain, Laura said, nodding with a sense of relief that they were taking swift action. She returned to Janet, maintaining a calm demeanor as she reassured her. The captain is arranging everything for when we land. Help will be waiting for us. Janet managed a weak smile. Thank you very much. You have been a godsend. But things took an unexpected turn for Janet herself. As Laura reassured her, Janet's condition seemed to worsen rapidly. Her speech started to slur slightly and her hand motions became less coordinated, signs that had alarmed the flight attendant even further. Janet, can you tell me exactly how you're feeling right now? Laura asked. Her tone calm, but her eyes scanning Janet for further symptoms. It's like my head is splitting and now my arm feels weird, heavy, Janet mumbled, her left arm hanging limply by her side. Recognizing these as potential signs of a stroke, Laura's training kicked into high gear. She pressed the call button to alert the captain again, this time with even more urgency. Captain, I believe the passenger might be having a stroke. We need to land as soon as possible. The captain, already coordinating with the air traffic control, responded immediately. We're making an emergency landing. Keep her stable and inform me of any changes. Back at Janet's side, Laura did her best to keep Janet calm and still. Janet, we're doing everything we can to get you help quickly. Try to stay still and don't worry. You're in good hands. As the plane made an emergency landing, paramedics were already waiting by the runway. Janet, still conscious but growing increasingly weak, was quickly and carefully transferred to a stretcher and taken directly into an ambulance. Laura briefly relayed Janet's symptoms and her recent travel history to the medical team, emphasizing the urgency. Inside the ambulance, Janet was surrounded by a flurry of activity as paramedics worked to stabilize her condition during the short ride to the hospital. The first thing they noticed was the angry rash on her head, which they attributed to the bite of an insect. However, it was unlikely that was the cause of her severe headache. There had to be something else. Upon arrival, she was immediately rushed into the emergency department, where a team of doctors took over, moving swiftly to assess her condition and begin necessary treatments. At the hospital, Janet was quickly wheeled into the emergency department where a rapid response team was ready. As she was moved to a trauma bay, a flurry of activity surrounded her. Doctors and nurses worked in coordination, hooking up monitors and preparing for a series of urgent tests. Dr. Lena Brooks, the attending emergency physician, took charge of the situation. She conducted a quick but thorough examination while Janet's vital signs were continuously monitored. We need a CT scan of her head immediately to look for any signs of a stroke or other abnormalities, Dr. Brooks instructed the team. Also, let's get a full set of blood tests, including coagulation profiles, and check for any infections that could be causing these neurological symptoms. Janet was swiftly taken for a CT scan, which would help the medical team determine if there were any bleeds or clots in her brain that could be causing her symptoms. Meanwhile, A nurse drew several vials of blood for the comprehensive tests Dr. Brooks had ordered. While the CT scan was being processed, a neurologist, Dr. Ahmad Khalil, was called to assess Janet. He performed a detailed neurological evaluation, checking her reflexes, muscle strength, and coordination, and closely monitoring her speech and eye movements. Given her recent travel history and the rapid progression of symptoms, we need to consider the possibility of an infectious cause as well, Dr. Khalil suggested. We should start empirical treatment for stroke and also cover for possible tropical infections until we have more definitive results. As the medical team awaited the results of the CT scan and blood tests, Janet was started on intravenous fluids and medications to manage her symptoms and prevent any further complications. The hospital's infectious disease specialist, Dr. Susan Choi, was consulted and recommended additional tests for tropical diseases, including dengue fever, Zika virus, and other less common pathogens that Janet might have been exposed to during her trip. She examined the rash on her head closely and declared it was likely the result of a mosquito bite. But the tests would show more. The results of the CT scan came back first. Dr. Brooks reviewed the images, which thankfully showed no signs of bleeding or significant brain injury. However, the scan did show some swelling, indicative of a possible infection or inflammatory process. The scan doesn't show a stroke, but we're not out of the woods yet, Dr. Brooks informed the team. Let's keep her under close observation and wait for the infectious disease panels and other blood work to come back. But that came back negative as well. Dr. Brooks was stumped. As the attending emergency physician, he was determined to uncover the root cause of her distress. The team had ruled out common and even rare tropical infections, and there was no evidence of a stroke or bleeding on the brain scan. Yet Janet's severe headache, dizziness, and neurological symptoms were escalating, not improving. The medical team convened to discuss the unusual case. As they reviewed Janet's symptoms and her recent travel history again, Dr. Brooks remembered a lecture he attended at a medical conference, which discussed unusual neurological presentations linked to environmental factors. An idea sparked in his mind. Let's go over everything once more, Dr. Brooks suggested, turning to the team. Janet came directly from her mission in Central America, where she was exposed to various environmental conditions. Have we considered all possible environmental factors, including toxins or exposure to unusual substances? Dr. Susan Choi, the infectious disease specialist, nodded in agreement. It's possible we're dealing with something unorthodox. What about heavy metal poisoning or exposure to poisonous plants or animals? These wouldn't necessarily show up on the tests we've run so far. Inspired by this new direction, Dr. Brooks ordered a more comprehensive toxicological screening, including tests for heavy metals and other neurotoxins that are less commonly encountered in their usual medical practice. Meanwhile, Dr. Khalil, the neurologist, conducted a more detailed interview with Janet, asking about every detail of her environment during her mission. During this interview, she mentioned working near mining operations in one of the remote villages, where she often used local water sources. The villagers mentioned they sometimes found strange residues in the water, but I didn't think much of it at the time, Janet recalled, somewhat uncertainly. I just assumed it was normal for the area, but the water did have an unusual taste occasionally, she continued, trying to remember any other details that might be relevant. She frowned, focusing on the memories of her time in the village. Sometimes, after drinking the water, I'd feel a bit nauseous, but I thought it was just the heat or the physical exertion from the day. Dr. Khalil noted this information carefully. It's important we consider every aspect of your environment there. Exposure to contaminated water, especially near mining operations, could certainly introduce various toxins into your system. Do you remember if anyone else in the village or your team experienced similar symptoms? Janet nodded slowly. Yes, a couple of the local workers mentioned feeling unwell at times, but like me, they attributed it to the long hours and harsh conditions. I don't think anyone suspected the water specifically, since these were intermittent issues. This piece of information was crucial. Dr. Brooks immediately contacted a specialist in environmental health, explaining the situation and the symptoms Janet was experiencing. They reviewed various case studies and medical literature on similar incidents, trying to match Janet's symptoms with known patterns of toxic exposure. Meanwhile, Janet was moved to a specialized unit where she could receive more intensive care. Her room was equipped with advanced monitoring equipment, and she was placed on a regimen of supportive treatments to manage her symptoms. This included IV fluids to keep her hydrated and medications to reduce her headache and nausea. The specialist suggested that Janet might have been exposed to thallium, a heavy metal often found in mining waste. Thallium poisoning is rare and can cause severe neurological symptoms, including those Janet was experiencing. When the results of the comprehensive toxicological screening came back, they confirmed the presence of thallium in Janet's system. The medical team was both relieved and alarmed. As the chelation therapy commenced, the medical team monitored Janet for any signs of improvement or adverse reactions. Her vital signs, including heart rate, blood pressure, and neurological status, were closely watched. The first 24 hours were critical as the body began to process and remove the thallium. To their relief, Janet responded well to the treatment. Over the next few days, her headaches began to subside, and her neurological symptoms showed signs of improvement. Her speech became clearer, and the muscle weakness she had reported decreased significantly. The rash on her head was treated with natural ointment and quickly disappeared, confirming it was nothing more than the result of a mosquito bite. However, the medical team was also aware of the long-term rehabilitation that Janet would need. Thallium poisoning could have lingering effects on the nervous system, so Dr. Khalil arranged for her to have follow-up appointments with a neurologist and a toxicologist to manage on any ongoing symptoms or complications. Additionally, Janet would need to undergo psychological counseling to help her cope with the trauma of the experience. A thorough investigation revealed that the mining operations near the villages where Janet had worked had improperly disposed of hazardous waste, including thallium. This pollution was the cause of serious health issues in the community, including Janet's symptoms. The responsible company faced strict regulatory actions and was ordered to fund clean water initiatives for the affected areas. Meanwhile, the community received medical and environmental support to recover from the exposure. Thanks to Laura's quick action and Janet's detailed descriptions, the medical team was able to quickly identify the source of her illness. This not only saved Janet, but also prompted a broader investigation that will protect others. Laura's role as a flight attendant proved to be crucial, highlighting the importance of alertness and training in all public service roles. What an incredible story of awareness and response. Have you ever witnessed a medical emergency on a flight? How did it go? Tell us in the comments below. Thank you for watching, and see you in our next video.